I'm Jenna, and my partner is Siobhan, and the theorist that we'll be doing our presentation over is Lydia Hall. Lydia Hall was born September 21st, 1906. She completed basic nursing education in 1927, a bachelor's in public health nursing in 1973, a master's in teaching of natural science in 1942. She was the first director of Loeb Center of Nursing and Rehabilitation, and she was inducted into the ANA Hall of Fame in 1984. Lydia Hall had a background as a research analyst. So to develop her theory, she believed in a total person approach for successful care for patients. So while working in the Loeb Center as the director, she looked at the environment of the hospital as the key to care and the rehab of patients in order to develop her theory. She developed it by focusing on the psychological experience for the ill individual, as she believed that experience of treatment included a lot of psychological difficulties. So using her knowledge of psychiatry, she assumed that the hospital environment during treatment played a huge role in helping with these difficulties or making them worse. So that's when she developed her theory of the 3 C's model. This model created a platform for providing patient care by incorporating the total person instead of just looking at their illness. And by doing so, she was able to educate nurses on how to deliver care to patients successfully and improve their needs. And then once she finally developed her full theory and implemented it in the Loeb Center, she was able to reduce the rehabilitation time for many patients. Lydia Hall's theory was developed in the 1960s, and it's known as the 3 C's of Lydia Hall, which focuses on 3 interlocking circles to promote the nurse's roles in providing care to the patient. The first C is care, which refers to the body. The second is core, which refers to the patient. And the third is cure, which refers to the disease. So in care, the achievement of interpersonal relationships with a person to develop the core is done by the improvement of meeting the patient's needs, managing nursing care, and building rapport with the patient. This phase really focuses on nurturing the patient and helping the patient attain any goals that they're unable to attain by themselves. Core is where the patient is making the decisions about setting goals that they're creating in collaboration with the nurse in relation to their own values, feelings, and beliefs. In this phase, they really emphasize the social, emotional, and environmental factors, including the family. So building a good support system can help the patient get that sense of belonging, and then they can express any feelings they have regarding their current health status or any potential life changes that they're going through because of this illness. And in cure is where the nurses are trying to provide that therapeutic understanding of the patient's healing process, and they're doing so with interventions, or nurses are also administering medications and providing treatments. And this way they can use Hall's approach as like a patient-centered approach, looking at the patient as a whole and not just their illness, to help guide families through the disease process and help these patients achieve their goals that they're wanting to achieve throughout their treatment.
Some of the strengths and weaknesses that I found while researching this theory was that it's a very logical and simple theory, so it's able to be applied to a large population, as well as it decreases the rehabilitation time of the patients as well. And some of the weaknesses are that this theory is hard for nurses who are not prepared to function with very little structure. This theory, it gives you like the key points, then you have to take those and apply it. And it doesn't give you like a set like step-by-step process of how to do that, because it varies from patient to patient and situation from situation as well. And also this theory does not do well with pediatrics, because this theory is really based on the patient and having the patient involved as much as possible in their care. And in the pediatric world, you're dealing with little kids, and they're not able to for the most part, kind of comprehend and understand and then make those sound judgments, primarily because a lot of the times it's going to be the parents who are going to be doing that as well. So some assumptions about this theory are that the motivation and energy to heal comes from the patient instead of the healthcare provider, and the three aspects of this theory, so the care, the core, and the cure, should not be viewed independently. They're very much interrelated, so you can't really have one without the other two to have an effective treatment. And they're represented by circles, equal circles, and that change in size depending on where the patient is at in their course of progress.
The diagram on the left shows Hall's three aspects of nursing, and I went into detail earlier about what each one is, but providing examples may be better to help understand this process. So in care, the nurses are really focusing on nurturing the patient. So this is just helping them achieve goals in activities of daily living. And core is where we're focusing on the goals that they had set by themselves about their feelings and values. And this way they can express any feelings they have regarding their current health status or any related potential changes in their lifestyle. And cure is where the nurse would administer medications or treatments, and this way they are advocating for their patients. And if you look at the diagram on the right, you can see that the circles are not all the same size, and some are overlapping more than others, and it's showing that core and care are predominant. And what this means is that the patient is in that phase of the disease process. So think about how you can apply this theory for nursing school by identifying the core, care, and cure. This case study is a short video of nursing students applying this theory to the stresses of nursing school.
Hi, I am Lydia Hall, and today I will be explaining my nursing theory containing the three C's, care, cure, and core, through a study case related to the stresses of nursing school. You witnessed the core problem that the RNs in training were experiencing from the stresses of nursing school. To cope with this problem, they turned to binge eating. In the next scene, you will witness the care given to the nursing students to help them cope with their stress. As you saw in the last scene, the nursing students were cared for by an educated RN who used her skill of hypnosis to help with the problems of stress and overeating. In the next scene, you will witness the cure that the hypnosis gave the nursing students. In the last scene, you witnessed the cure to the core problem. The nursing students realized that the stresses of nursing school were leading to other problems in their daily life. The care of hypnosis helped the nursing students cope with their stress and perform better in the classroom.
So here's an article I found applying the theory to heart failure patients in hospital readmissions. It was kind of broken up into two studies. The first one was a pilot study, which included 50 heart failure patients, 25 which were discharged with home health, and 25 that were not given any post-discharge interventions. And the second study was much larger. It consisted of 542 heart failure patients that were admitted to the hospital between January and December of 2004, with 132 patients getting home visits and 120 that did not. For both groups, the intervention groups were given packets, regular home visits, and phone calls from registered nurses with education and calls from social work to provide support for them. With the smaller pilot group, the groups that received the interventions had 0 readmissions in the first 60 days following discharge, and the group that did not have any interventions had a 4% readmission. In the second study, the group with the interventions had 14 readmits, and the group without had 37 readmits. So the researchers concluded that there definitely needed to be further studies to be conducted, but they did see a decrease in the readmissions when the patients were given more instructions to be involved in their treatment while in the hospital and post-discharge. So this kind of reinforces the theory that emphasizes the importance of total patient care rather than only treating one aspect.